Where do we start here? First of all, the numbers over the weekend were 416 positives over the state. Was that a one-day total, or is that the weekend total?
That was the one day for Friday. We have about 800 cases over the weekend that we're going to report today. We're seeing a pretty significant bump in our cases. We're just covered up with Delta variant.
Yeah.
Almost all the cases that are circulating Mississippi are Delta variant. Is making it really tough.
Well, if it's that way now, it's just going to get worse one way or the other.
Yes, sir. I think it's going to be a tough run for us for a couple of reasons. We still have too many folks who are non-immune because they're unvaccinated or never had it. And one of the things that we're learning is that if you had natural infection before, the Delta variant is really good about getting around it, right? So the vaccine looks a lot stronger for Delta variant than natural infection, and that's going to help drive our case jump too.
All right. Now, I want to, because this is something that we were talking about with a couple of other people on Friday, and I think it's new information for a lot of folks. And you're basically saying with the data that you have, Dr. Dobbs, is that if you've got COVID naturally and you decided, okay, I got it, I got the immunity, I don't need the shot, you're telling me that you could get this because the vaccine would protect you, for the most part, from the Delta variant, but having COVID previously will not protect you and give you the immunity over the Delta variant.
Yeah, not enough. And we do know there's actually new data out that shows that if you've had COVID before and get one shot of mRNA vaccine, you have 1,000-time increase in your antibodies against Delta variant.
So what's the suggestion for people who've had it? I mean, if you've had it and you've recovered, and how long after you recovered could you have the shot?
They said wait 90 days if you want to, at least until you're over it. But now with the Delta variant, I would say as soon as you recovered from COVID, go ahead and get it. Usually 2 to 3 weeks is pretty good. The other thing is with the Delta variant, you really have to have 2 shots. And so we have too many Mississippians out there that have 1 shot of the Pfizer or the Moderna. And we know that for Delta variant, that's really not even remotely adequate. So if you're one of those folks who've had 1 shot and just kind of say, I think I'm pretty good, please go ahead and go out there and get your second shot.
Regardless of when you had that first shot, because it really doesn't matter, does it?
Yeah, no. I mean, it says, within 6 weeks is kind of the ideal, but if you had it even 3 months ago and you kind of were behind, there's no back end to it. So please go ahead and get that second shot. The
reason I want to go over that one more time is that because I've talked to some people who said, well, I got the shot 2 or 3 months ago, and now I guess I'm going to have 2 more because the old one's no good. And you're saying, no, if you had that first shot, you have some antibodies, but you need that second shot regardless of how long it was when you had the first one.
Yes, sir, yes. So please go ahead and get out there and get that second shot. And the other thing is we have too many older folks who are still not vaccinated. We still have about a quarter of the population in Mississippi over 65 who are not vaccinated. And I think there's a whole host of reasons for it. But I'm really worried about Delta sweeping through. And, we put up this recommendation that if you're older or if you have chronic medical issues to kind of lay low for a few weeks and avoid large, indoor mass gatherings, because we're starting to see a lot of outbreaks. And sadly, we're seeing a lot of circulation in kids, and it's being amplified into adults now. With summer activities, most kids are not immune or vaccinated, and now we're seeing it really spread into the broader population.
That's the worry that a lot of people have, is because with that, you said there's still about a quarter of elderly people who have not, or over 55, who haven't been vaccinated. So if that's the case, we're wide open. We're not wearing the mask in a lot of different places. We have all of our summer activities going on, and a lot of young people, especially with the contagious factor of this thing, anywhere from 60 to 90% more contagious. Chances are it's going to reach those people who are not vaccinated.
Oh, yeah, and we do have data that shows that the vast majority of kids are not immune. It's easy for some sort of rumors to circulate where people say, well, I think the kids all had it already, or, they're probably all immune already. We have we have data from different labs looking at it, and it's a small minority of kids who've had it before. So most kids are vulnerable. And I will say, most kids will get over it just fine, but there are some severe things. And even for kids 12 and older, we do recommend it, but we're especially worried about people who are over 65 or people who have diabetes or heart disease or high blood pressure, because we know that it'll kill them.
Let me ask you this. When you said the word kids, how young are we talking about?
Kids under 18, that's really where we have the data sort of broken out, is the vast majority of kids under the age of 18 are not immune. They're vulnerable. Which brings up this other point, is it's important to reiterate that the vast majority of cases, over 95% of cases, and over 90% of our deaths are in unvaccinated people. It's the unvaccinated people who are getting it, but now they're putting other folks at risk too. Unfortunately, I mean, it's just the nature of a pandemic. There's nothing political about it. It's just a virus that's trying to spread and cause havoc.
But most of those deaths and cases are over 55 years old or older?
Yeah, most of them are over 50, although we are seeing more and more people in their 40s, because our vaccination rate in our 40s is really pitiful. Because most people in the 40s, and I talk to even my family members, I think, well, I'm not really at risk. Even in my hospital here, we've got like 3 40-year-olds who were just decimated by it, totally healthy, hardworking, wonderful folks who didn't think it applied to them. And now, I think they're going to make it. But, 2 months on a ventilator will take its toll on you.
Jeez. I think, one of the problems we've had, not only with the Delta variant, but just COVID-19, is a lot of people who think they're bulletproof, and a lot of us are that way. We get a cold or something, even if we think it is COVID, we just wait. We feel like we can battle it on our own, and that's when it has a chance to really get nasty. And I think that's even more so as far as the Delta variant.
Oh yeah, without a doubt. It's just so much more contagious, and it does seem like it has maybe a little bit more severe illness. I think that's still sort of up for debate. But I understand Mississippians were kind of an independent-minded, sort of hardy folks, and I know that we think that we can overcome. But if you're one of those folks who ends up getting it and devastated, it really does worry me, because we're going to have a lot of people who suffer needlessly when they can just get one of the shots that they're safe and effective. And we've given about 1 million Mississippians have gotten them, and we haven't seen really any problems from it at all.
Are you recommending, is Johnson in this trio here, or is Johnson out of that as far as the Delta variant?
Yeah, Johnson looks like it has retained efficacy against the Delta variant. I mean, just Pfizer, Moderna, and Johnson both seem like they have some retained efficacy. We'll say it's probably a little bit less. Looking at different data sources, there's kind of a scatter, but it looks like it's going to be more like 88% effective versus the 94%